Hi there everyone. Today we're going to discuss about how we can deal with our customers, either internal customers or external customers. Being a pharmacist, you will face a lot of problem whether you are dealing with patient counseling or either you are dealing with patient medication itself. Let us talk about outpatient pharmacy, how they can deal with their customers. First of all, you have to identify what a customer needs and who is your customer. Is it everyone coming to you asking anything? No, it's not the case. Actually, what you do is to look at the patient's profile or the patient prescription he is here for. Sometimes it's just simple over-the-counter drugs that he's taking, and sometimes he's on prescription medication like antibiotics or any other prescription medication, maybe narcotics. Depending on that, you will identify your customer and their needs also. Definitely, when you are dealing with an outpatient pharmacy, so you have a lot of customers that are having multiple diseases and they are taking multiple medications. So it's you can say it's a combined therapy that sometimes the patient is taking and he's not compliant. So there the role of a pharmacist comes. You have to identify the customer. By this we mean that whether the patient is literate enough to understand what he is taking, or he's a total layman. He doesn't know about anything. You can use the probe technique. Probe technique is to dig out questions, to dig out patient history, to dig out different information about patient. Talk to him in a polite and gentle way so that he will not get irritated by asking so many questions. You have to be very friendly with your patients or your customers. So in outpatient settings, usually you don't have much time and much information available. So to be very smart, you have to ask specific questions that will make your work easier to get familiarize yourself about your patient's history. First of all, you will have to get a quick look at the prescription of the patient. It contains what kind of medication, either they are simple medication or over-the-counter drugs. You can give him simple counseling points related to those medication. Some of the medication that require counseling, you can give them a brief introduction about the medication, how it works in a simple way, and a common list of side effects that are occurring with that medication or associated with that medication. And you have to tell him about the side effects in a way that he will not get scared about them. But what are these side effects? I cannot take them anymore. So these are the points that you should keep in mind while dealing with a patient who is a layman, or either he's educated but he's not a pharmacist. He's from another profession. So you have to identify your customer, whether he requires small information or a bit of information, or he requires a lot of information. Because sometimes when you ask question, the patient himself is asking different kind of question that you have to answer. So you have to be very precise. You don't have to go into the depth. You have to tell him those information that is necessary for him, not to tell him all the things that are for healthcare professionals. That is not necessary for them. Maybe they will not understand what you are saying. Don't use terminologies too much. And you have to identify what are the needs of the patient. Maybe he require only a small piece of information, and he knows about it already, whatever he's taking, because usually the patients are on those medications from a, from a month or so, from for a long period of time they are taking those medication. So depending on that, you have to identify the needs of the patient, what they are requiring. If the patient medications require therapeutic drug monitoring, so you have to tell them to monitor those medications. Suppose if he's taking warfarin, suppose if he's taking digoxin, suppose if he's on rifampicin, suppose if he's on any antibiotic that requires regular checkup in case of lab reports or blood reports or WBC count, or some of the medication that have certain side effects like clozapine. So you have to inform the patient about the necessity of the lab results and the necessity of doing labs de- depending on the type of medication as per prescribed by the physician. So you should tell him basic information how to interpret the results that he's getting from the lab, so that he's not totally, you can say, he's not blank totally about the information what he has in his hand, and he's not aware of it. He has to wait for that long to get satisfied about his results, to know about his result, because he's curious about getting information about this lab report, because this is about him. This is very important for him. So you have to make his labs, the way he take his medication, very important for him, and make him realize that you are very important for us, you are our customer. So you have to fulfill the customer needs as well, depending on the type of need he requires. Suppose if he requires a different strength of medication, I'm just giving an example, so you have to change the type of medication that he's taking right now. For suppose if he's taking 2.5 milligrams, and you are giving him a strength that cannot be divided equally in that dosage form, so you should not give him a type of medication or the type of strength of that medication that is not divisible easily, or he requires special tools to divide it. So you have to make him realize that you should know about your medications. You have to fulfill customer needs. You have to know about all all the conditions of patient, either social or mental status of the patient, whether he is able to take the medications by himself or he requires an attendant to get involved in administering those medications. So you have to fulfill customer needs. Suppose if you are giving a pediatric patient inhaler device, so you should know that this patient will require a spacer device or not, or he's able to take it without a spacer device. So you have to check the needs of the patient. When you are giving a patient insulin, you should give him the Novo needles also along with that. Otherwise, he will not be able to take it. Maybe he might miss a dose, or any emergency situation can happen to him if he will not find a needle. How he will administer that? So you have to be smart enough to identify those needs. What obstacles you have, what mistakes we do. So what obstacle we have, and if we will not identify those, we will make mistakes. The obstacles we have: cultural aspects, religious aspects. Sometimes if you are dealing with a female, you cannot tell openly some of the medications that are used by females. So if it's a religious point that is becoming an obstacle between you and the customer, so just ask the same gender to explain it. Or if he or she is comfortable explaining that, so it's okay. Depending on that, you have to fulfill the customer's need. What mistakes we do sometimes we are in a hurry, so we miss a very important part. Suppose if I'm in a hurry and I give a patient warfarin, and I will not tell the patient that you have to avoid these foods that have a major interaction with it, or these drugs that should not be taken with calcium, or these supplements should not be taken with the antibiotics, so it can cause a severe interaction with that medication or severe side effect associated with it, or the labs are not monitored on time, so he might get adverse reaction from the same medication he is given for for a disease to get cured, but he's not getting a cure from that medication, so it's useless for him. So it will be our mistake that we are not telling him everything. So it should be very clear that we will tell them all those issues associated with that medication, or all those important information that we should not miss, and never ever, because this is very important for the patient. And this is also important, one mistake that we are doing most of the time, that we never ask the patient what you understood. So we should use the technique read back to me what you understood. So whenever you tell something to a patient, you ask him what you understand, can you please read back to me. So this technique is very helpful that we have used since long time in our pharmacies. When I worked in inpatient pharmacy, also when we were counseling the patient, when I worked as a trainee pharmacist in the outpatient pharmacies, I remember we used to do these techniques and I saw my seniors doing that. But now, after a long time, I had a lot of experience about inpatient pharmacy and critical care areas, how patients are suffering from these small mistakes. Because of our mistakes, they are suffering. So we should explain each and every single thing about the medication. This is our part, this is our job. So we have to fulfill the needs of the patient by giving them all the information, all the relevant information. Sometimes you should be very specific. So how to overcome our weaknesses? This is how we will do it. We have to identify our weaknesses also, that whenever we are counseling a patient or whenever we are dispensing a medication in outpatient setting or either in a discharged patient in inpatient. So we should be very careful in both the ways. We should use the readback technique. We should do the probe technique to identify all the loopholes or all the weaknesses done by the patient in understanding his medication. So you have to confirm whether he is 100% sure what he is taking or not. So to overcome our weaknesses, we have to tell the patient in different ways. We have to show diagrams, we have to show them a written material, and we have to explain them in a simple language. These are our weaknesses, that we are telling them terminologies and all that they don't want to listen and they don't understand. They just shake their head just because they want to get rid of you. So you have to be very simple, friendly with them. First of all, make friendship with them, then start your counseling or start explaining about any medication or whatever counseling you are doing. So these are the weaknesses that we are facing. So better to use charts if possible. Better to use diagrams to explain patient how to take special medications like inhaler devices, insulin pens, rectal suppositories, or enema, how to use it at home. So depending on the type of medication, you should tell them about it. If you are giving him an antibiotic, any kind of it, and it's a suspension, so you should tell him that if you will find this kind of suspension, so how you will reconstitute it, and in which so solvent or diluent you will use to make it a suspension, and how much mLs you will have to use. Tell him how to read the instructions on a box and how to check the expiry and how to store a drug whenever given to him from an outpatient pharmacy, or when he's getting medication from a discharge pharmacy, or when he's coming for refill, taking his refill from the community pharmacy. So wherever he's going to get his medication, so he should check these points for confirming whether the medication is in proper or good condition or not. So these are the weaknesses from our side. So we have to be very specific. We have to tell them the right information that they require. Secondly, but it's not actually happening all the time, and we can say it's a weakness among all the pharmacists that we found in different hospital settings, whether it's inpatient pharmacy or it's outpatient pharmacy, that we lack team motivation and teamwork. Whenever we lack this, believe me, you will make your work all upside down. You don't have a teamwork, your work will not be in a flow, and you will have medication errors, you will have uh, fight with your colleagues, you will have other issues associated with it, mm, cash miscount, medication wrong counted, wrong medication dispense. We have to give 5 milligram, you give 10 milligram tablet because of you no team work in your pharmacy. So you have to become a good part of your team and make the team better and better daily. You have to play a role, a very major role. Being a pharmacist, you should lead the group in a way. I'm talking about the managers especially, and the head of the pharmacies, that they have to play a very important role in managing the conflict management. They have to be expert in that, how to manage the conflicts among your staff. They have to play as a leader in their team. They have to fulfill the needs of their team. So if your team is happy, they will automatically get motivated. So these are the key points that you should keep in your mind. These are the crisp of the presentation and the discussion that we did uh, in our meeting. We love our customers, and if you are willing to attend these kind of lectures in future, definitely like our page, Ask Your Pharmacist, because if you will like it and you like this presentation, we have a lot of information about pharmacists and patients also. We can release information in your own language even if you will request for. Especially we are working on one project that is associated with the translation in Urdu, and we are trying our best to work on that project as soon as possible, and we will keep on updating our website by uploading different educational videos, and I hope you will like it. So be a part of Osteopharmacist and promote it as much as you can, and we will be there to educate you in different ways. And if you like to have a live pharmacist with you to get help for any drug information query or any poison control query, you can give us uh, a brief information about what you are trying to ask and for whom. At least whenever you are sending a question, please don't forget to mention the age, weight of the patient, uh, and the condition that is with the patient, and how long um, already passed since you are telling us the question. So we are not aware of how long have been passed already, that the patient is suffering this condition, that the patient is suffering from this condition. So you should tell us how long and what's the age and who is the patient, male, female, it will be easier for us. Or if it's not possible for you to give us all these details, at least don't forget to tell us about the name of the medication. Sometimes people ask about what should I take in this condition. This is not our part. This is the part of the physician. Our part is about all types of information about your medication. Once you will tell us about the medication, then we can tell you further about how to use it, how to store it, and if you are taking it properly or not. That we can guide you. If we have further questions, we can ask you further for confirming and giving you a detailed answer. And you can get our services for personal pharmacotherapeutic plans. If you are a chronic patient on any medication, then we can help you out sorting out your issues. We can help you out in telling you where are the stocks more available in which pharmacy and where you can find it easily. So we can help you in different ways. So ask your pharmacist is just a solution for you. As you can say, we are not there with you, but we are there if you will ask us. So that's why we are ask your pharmacist. So whenever you need us, just send us a message on Messenger, Facebook, or simply send us email as mentioned before. You can write it on the wall even. So there are so many ways you can contact us. Thank you for listening and have a nice day.